Hi, this is the Cancer Patient Lab, and I'm Brad Power, and we're honored to have with us today Scott Petinga. Scott is a cancer survivor and also a caregiver for his daughter, and he's going to tell us about the approaches that he's taken to deal with his cancer and his family's cancers. Um, and Before we get started, I'd like to just do our standard housekeeping steps, which are three. The first is this is for information purposes only. This is not medical advice. And we try to arm patients with information they can take to their medical team. Second, this is all public. Everything you say can and will be made public. So if you're concerned about your image or your name being made public, then hide your name, change your name, and don't share your image and um, don't say anything. And then finally, we are a volunteer-led nonprofit. And so we would appreciate any contributions you could make, which you can do through our website at cancerpatientlab.org. And we have a donate button there. And Giving Tuesday was yesterday. So give once and give generously or whatever. And with that, I'll turn it over to Scott, who's going to kick us off with an introduction of his situation and his story.
Fantastic. Well, Brad, truly appreciate you inviting me here. I'm excited to tell my story, and I'll just jump right into it. So I'm essentially a marketing analytics guy, but there's an interesting point to this. There's two parts of me, before cancer and after cancer. Before cancer, I was an artist, not this type, but this type. So I did a lot of marketing for a lot of big Fortune 500 companies. I'd always present to, ginormous boardrooms, lots of opinions, lots of egos. I believed all these people lived in their ivory tower. They didn't understand who their consumers were, what their consumers wanted. So unfortunately, because I was an artist and I couldn't get consensus among a lot of the people in the boardroom, I essentially was a starving artist. So I realized art, like everything, is subjective, right? Tons of emotions, opinions, judgments, assumptions, personal beliefs. It all varies based off of us individually. But I wanted my art to be more objective, measurable. And then what's interesting, again, when you're creating an advertising campaign, whether it's a Super Bowl commercial or just a piece of direct mail, my thing is like, I don't give a shit about your opinions. Does it work or doesn't it work? So I decided to literally create marketing that actually was devised and developed almost like a clinical trial that we're all familiar with, right? I would have a sample size. I would break people up into two different groups. One would get treated with a marketing stimuli. One would essentially be the placebo group or the control group who wouldn't get treated. And the idea was to understand the efficacy of the marketing program in place. And it was truly about that. Did it work? Did it drive sales? Did it do what it was supposed to do? Um, at the end of the day, I worked for some of the most prestigious brands in the world, truly global brands from Puma to Bentley, Pfizer, Ford Motor Company. And what I did actually did move the needle. At that time, I lived in Chicago, got married, fell happily in love. And literally within 28 days, I was diagnosed with stage 1 testicular cancer. So, I was working the 9 to 5, thought I was invincible. Again, get diagnosed with cancer. Um, again, right, just like all of us, I was 31. I never used any type of medical care in my life. I'm living in a small little town called Reading, Pennsylvania, which is about an hour and 45 minutes outside of Philly. Um, I didn't know any better. So I had surgery. I had tremendous amounts of radiation, 10 rounds of photon beam radiation. And of course, like all superheroes, right? I was exposed to radiation. I got my spidey sense, my superpowers. But I also worked for a Fortune 200 company at the time where I thought I had amazing benefits, where I thought I could take some time off and they wouldn't let me. I literally had to work through the entire cancer treatment. And that truly changed my world. That truly changed how I viewed benefits, both from an employee standpoint as well as an employer. My fertility also, being 31, getting recently married, the only thing I ever wanted to do was be a dad. And yet the tremendous amount of radiation along with the orchiectomy prevented me from having kids, and I was infertile. And the only thing that truly mattered to me, like I said, was being a dad. So I truly quit my job at that Fortune 500 to start my own company. That's essentially my first office in my spare bedroom. And it was all in the means to go through in vitro in order to have a baby. I know I had to go through in vitro. That was my only hope, my only chance. And it worked. So I essentially, at that point, was able to have 2 kids via IVF. But to go back to the beginning, right? We all walk into a doctor's office. They have a lot of pieces of paper on the wall. When I walked into Reading, Pennsylvania, urology office, the guy was old. So I assumed he knew what he was doing. He had a ton of paperwork on the wall, Ivy League educated. I assumed because he was old, he was Ivy League educated, he was the guy. But unfortunately, he wasn't. Not only did he lie to me, is he withheld information from me so I could clearly make the total decisions that I needed to have. And that's not just my care. My nephew's 26 years old, just got diagnosed this summer with stage 1 testicular cancer as well in South Jersey. Same thing, the doctor withheld information from him. My daughter gets diagnosed in September with an acoustic tumor. Doctors withhold information. They're literally presenting information to guide you down and pick the answer that they want you to pick, not necessarily providing you all the information that we need as patients to pick fairly, to pick where we want to go. So the turning point for me was I lost a testicle and the other one got damaged during the process, which means as a man, I have no working testicles. So I started to basically become incredibly hormonal. So at this point, I'm late 30s. I'm experiencing hot flashes. I'm experiencing signs of dementia and Alzheimer's. I seek treatment at the Mayo. My body's literally starting to break down. My tendons are snapping. My chest is collapsing from all the radiation. It's becoming incredibly problematic. And I literally moved to Minnesota so I could do follow-up at the Mayo. 3 years, most people, if you're not familiar with the Mayo has a program called an executive physical, where you pay a lot of money out of pocket, you get concierge care. It's about 10,000 bucks, and you get a slew of tests every single year, and they run you through the gamut. Executives from all over the world come here, get it done. The problem is they didn't care about why I was there. I'm symptomatic. I can barely get out of bed. I can barely function. I don't know how to get home, certain days of the week because my memory is shot. And they just blamed it on me being exhausted, on me being a serial entrepreneur and being too busy and not focused. They blame it on me having newborn children and being, a dad. No one cared about all the things that were happening to me were a result of the cancer, were a result of the residual treatment. So I started, we all know, right? This is America. There's all these lines of concierge doctors now that they're being called. There's all these nurse practitioners. There's all these individuals who have the ability to write prescriptions. And a lot of them are pay to play. So I flew to Vegas, found a concierge doctor, gave the doctor $2,000 a month, and that doctor allowed me to play doctor on myself. So I wanted to inject myself with testosterone. I wanted to do it in a clinical trial setting. I wanted to measure what happened to me from a hormonal panel, from a blood panel, from a CBC, from a brain functionality. So I did that for about 9 months and I felt dirty. I felt like I was doing something that shouldn't have been done, wasn't under necessarily total guidance. So I decided to partner with University of Southern California. And I had this hypothesis that depending on how much testosterone was in my body, determined how my brain actually functioned. And this was 10 years ago, right, where there was no machine learning, there was no AI, and computing power to actually do a functional MRI just didn't really exist. But they took 10,000 images of my brain with hormones and without hormones, And it took over a year and a half to process all the images, and they found that there were truly a difference in my brain. And they're like, but you're just an individual, one person. This is a sample size of one. There's nothing we can do. So I needed to seek answers, right? That wasn't good enough for me, is you're just one person, it's anecdotal, who gives a shit? So I wanted to seek answers. I went out, I talked to the best of the best, endocrinologist. And interesting enough, endocrinologists will not treat a male with hormonal issues. Mind blowing, right? Because an endocrinologist, we all think, is a hormonal specialist. They are, but not for men. And particularly not when it comes to testosterone. So when you have testosterone issues, which is impacting your hormones, you actually have to see a urologist, which, as somebody who hasn't been in medicine a long time, was just mind blowing. It's almost like thinking of it from a perspective of your home, right? If you're having an electrical issue, which neurology is, they're telling you to call in a plumber. Again, right? That makes no fucking sense at the end of the day outside of the medical world, but that's how the medical world works. So I decided to do something about it. I decided to literally scour the internet, and if we'll share this with everybody as well. But these are resources most people are unaware of that I found completely fruitful for finding information that doesn't exist anywhere else, not even on the NIH. So I've used this for myself over the years. I've used this as a patient advocate to help other patients. I've used it for my nephew's care. I've used it for my daughter's care. Highly informative, definitely sourced and not necessarily tainted by pharmaceutical companies funding research. So at the end of the day, what I realized is in order for me to get the answers I want, I had to fund my own research. And at that point, as a serial entrepreneur, I made a decent amount of money. So I funded 2 studies, one at University of Southern California, USC Norris, for $500,000. And then not only did I do it once, I did it twice here at University of Minnesota. Long-term studies on the impact of hormone suppression is the main one when it comes to brain functionality. And the other one, realizing that testicular cancer, particularly the lower stages, stage 1 and stage 2, the treatments were antiquated and not based off of real science, and was based off of studies that were done literally 50 years ago by Einhorn in Indiana. So they were outdated, irrelevant, and unfortunately, right, the standard of care in America was different in Europe, which is still problematic. Right now, if you're early stage testicular cancer, and if you do need chemo, standard round in the US is 3 rounds of BEP. In Europe, it's only 2 rounds. That additional round, the toxicity of that additional round is problematic. Hearing loss, and a tremendous amount of other side effects. So the lessons that I've learned, which is more importantly, is we do all have time when we're diagnosed. Doctors want to scare us into making an immediate decision. They told me I had to make a decision within 24 hours. And I was scared shitless that I had to make a decision in 24 hours. I didn't know any better. My nephew, who got diagnosed 20 years later, same thing, is they told him he had to make a decision in haste. I'm like, you don't, you have time. My daughter was the same way. They wanted to have her on the table literally within hours of her being diagnosed with a tumor. We actually waited 6 weeks so we can get the information to make a decision that was based on science. The other thing is we have to truly understand the economics of medicine, right? Particularly in the cancer world. 50% of the surgeons are somehow getting paid from pharmaceutical in some regards, right? That's a stat that can be found all across the internet. It's just not me. So my thing is, I'm always joking around, is when I walk into a doctor's office, a surgeon office, right? His jacket should look like a NASCAR jacket, right? Or a car. I want to know everybody who's giving you money, anyone who's sponsoring you, anyone who's influencing your decision, so I can make the best decision for me. Secondly, is what I've talked about before we jumped on this, is medicine's not a dictatorship. I'm sorry, right? It's a partnership. It's collaboration. All you are is a doctor basically an asshole with an opinion. That's all you are. Yes, you went to school. You're just an educated asshole with an opinion. So I have thoughts. I have opinions. I've done my research, as we all have. Sit down, listen to me, respect me, right? Just because I've never went to college, I've never studied medicine, doesn't mean I don't know about my disease, about the treatment. I've done my homework. I've talked to your peers. I know what I'm talking about. So I think a bunch of different things, like I talked about, just to recap, right? Know your condition. There's a tremendous amount of resources out there. If you haven't heard of Immerman Angels, it's an incredibly important resource. It's a matchmaking service that matches you with somebody who has your same stage for the same age. They can't offer medical advice, but it's a great sounding board. I'm an angel myself. So people call me who are in their 30s or stage 1 testicular cancer in the Midwest. Um, it's highly valuable. I had my nephew reach out when he got it. Also, know the most effective treatment options, right? Just because your doctor's recommending something doesn't mean the efficacy of that treatment is there. So there's the NIH, right? There's ASCO, there's bio. And then most importantly is seek a second opinion. I've done a lot of research in the second opinion side. Breast cancer, about a third of breast cancer patients are receiving the wrong diagnosis. That diagnosis is more severe than the actual disease. 50% of all overall cancers are misdiagnosed. And if you actually go to an NIH facility to get your second opinion, that second opinion will be less severe when it comes to treatment, when it comes to disease as well. So if you don't have the ability to get to an NIH, the great thing about telehealth now, it gives us that access. And one thing which is incredibly important too is what I call biohacking, right? Is understanding the ability to manipulate your environment, right? And when I say manipulate your environment, again, it's like my daughter, right? I found out that with my daughter's condition, if we gave her fish oil pre-surgery and then post-surgery, it had the ability to lessen the risk of facial paralysis. Well, I didn't know that going in. So when we first met for my daughter's condition, we were told she only had a 1% chance of having facial paralysis. That statistic is not true. It's not fact. It's fact when you look at overall conditions, but my daughter had a 5-centimeter tumor. It is one of the biggest tumors for this disease. On that size tumor, it's almost probable that she would have facial paralysis. Again, we weren't told that. So after surgery, 12-hour surgery, the doctor comes back. He's like, I got good news. Her tumor's 100% removed. The bad news is she's paralyzed. We're like, what the fuck? No one ever talked about paralyzation. It was 1%. How did we get the 99% card? Right? So after the fact, after we found out she was paralyzed, we started looking into what can we do to prevent her to be basically permanently paralyzed. And then I came across this study that was actually done at the Mayo clinical trial that was terminated for not having enough patients participate. But the Mayo was actually looking into the efficacy of fish oil on paralysis. We were never told that. The doctor never put her on fish oil before he did the surgery. It could have helped, but immediately afterwards, I actually reached out to the clinician who was working on this omega-3 study, who's no longer at the Mayo, and we had a half-hour chat. He's like, put her on, immediately. He's like, it's promising. There's research out of Asia that's promising. So we immediately did that. The other thing I looked at was red light therapy. Red light therapy works for facial paralysis. It's one of the key treatments in Bell palsy nowadays, particularly in Europe and Asia. So I can't put her on red light therapy yet because she's still on steroids and they counteract with one another. But next week, when she's off of her steroids, I will be immediately put her in red light therapy to try to make the paralysis temporary and not permanent. Same thing as I've seen it with myself and my care and others. Meditation, right? They've done a tremendous amount of research when you're in the right mind. your body can essentially heal itself. Stress is horrible when you have cancer, makes it spread. That's fact. Calorie restriction. There's a doctor out of USC. His name's Dr. Longo. He focuses on ketosis and cancer treatment. It's proven it works. I'm probably in the best shape of my life now due to calorie restriction and being on a very low processed food diet, very low sugar diet. And again, high protein, but good proteins and vegetables. Um, Cold water therapy, I do that as well. And I don't have an ice bath. I don't jump outside in a bed of water. I literally turn my shower from hot to cold. And I do that for a small period of time. And I believe that works, particularly keeping me thin with low body fat and heat exposure as well. Sauna, steam room, again, all proven to work in different components. Most importantly, supplements too, like I just talked about with the omega-3s. When I was having a lot of brain issues, I've studied about the brain. I studied supplementation. There's an amazing doctor out of Austin. He's a neurologist. His name's Perlmutter. Phenomenal individual, but he talks about how genetically some people are predisposed to have dementia and Alzheimer's, depending on your APOE, depending on some other things. Amazing book, but he talks about how supplementation is so important for brain health. Lastly, before I finish up, is just, two things that got me by that made me focus, right? Real life has no signs, no straight lines. They're just a maze of infinite options. Same with healthcare. There's no right answer. There's no wrong answer. And the same thing with Charles Darwin, right? It's not the strongest of species that survive, nor the most intelligent. It's the most adaptable. So kudos to everybody in this group, right? I think we realize that, we're probably not the most intelligent, but we are, I think, some of the smartest, and we are willing to adapt. We are willing to change. We are willing to get better. So that's my story.
Thank you, Scott. We'll be opening it up for questions now. We use the raise hand feature. If anyone has a question, they can raise their hand and I'll call on them. And I'll also be monitoring the chat, see if anyone has any comments or questions there. I would just ask one to get while people are thinking about their questions, Scott. How have you multiplied your impact? So you've just shared with us. What is your approach, given your marketing background in particular, to sharing what you've seen and learned and making it more accessible to other people who might be interested?
Yeah, so I share my story on social media. I believe, right, social media has a tremendous amount of opportunities. LinkedIn, for one, right, connecting to doctors, to people in the pharmaceutical world, to clinicians. So that's one thing, is telling my story, telling my daughter's story, my nephew's story. So telling as many stories as I possibly can. And how, again, we do have options, right? There's more than just the traditional, like I said, my biggest thing has been aftercare, right? The whole survivorship side. So again, what pisses me off, even the doctor at the Mayo, is he literally removed the tumor and he's like, I'm done. And I'm like, what about her facial paralysis? And he's like, I did my job. My job was to remove the tumor. Her facial paralysis is not my problem. And the great thing about the Mayo is how tremendous the talent is under one roof. So my daughter's mom and I just started looking for stuff. Like I said, she works in the neuro unit. So she asked her doctor what we can do. We found out and we uncovered this thing called facial reanimation. And the Mayo actually has a specialty about facial reanimation. But the doctor didn't know about it, which is crazy because he caused the paralysis. And my thing was like, I need to talk to the doctor in the morning. And they're like, oh, no, you can't. And my thing is, you got to fight your battles, right? So I raised holy hell that I better see the doctor before the morning comes. And sure enough, the doctor was there because I raised a stink. And my daughter who's sick, Brooklyn, she calls me a Karen. And I am, right? I mean, I'm going to do whatever it takes for myself or my family to get the best standard of care. And I don't care who I piss off along the way or who I upset, right? I don't care if I hurt your feelings, is I'm trying to get the best, and right, to centralize, minimize those long-term side effects. Because 20 years later, I'm still battling, right? Yes, I'm cured from cancer, I'm in remission, but I got a collapsed chest, my ribs aren't connected, my lungs are impacted, my heart's impacted. I've had 50 surgical procedures just to get hormones in my body, 2 wrists replaced, right? 2 rotator cuffs, both hips replaced. So I don't care you did your job. I'm trying to make life easier in the long run for me and everybody else, particularly as we get diagnosed younger. My daughter 15, my nephew 26, I'm 31, right? We got 20, 30, 40, 50 years ahead of us, hopefully, knock on wood. But that's the thing. Tell your story, tell it often. Secondly, um, like I said, the more knowledge we find out, we uncover on our own, I believe it's up to us to share it. To, like I said, to be part of Iberman Angel. So when someone's in our same trajectory, that right, we can give them everything we've learned, we've experienced, so they don't have to walk the difficult challenges that we've had. Right. To go into some of these groups on Facebook. Facebook is a tremendous area because there's literally um, groups for almost every single disease out there. So go there, tell your story, impart your wisdom, I think is tremendously key. My thing is, because I'm a marketer, I've also used my story to get major press, right? So I've been in Entrepreneur Magazine, I've been in Forbes, I've been in Vogue telling my story, even Playboy, because that's where young men are. So I think that's the thing, is we all need to go out there and tell our story, because without those stories being told, we're forced to, the only information we're forced to see is the information that's being feeded to us by the practitioners, by the pharmaceutical companies, by the medical device companies, and that's not the world we want to be in.
Thank you. Couple of hands raised. Chad Magnuson.
Talked a lot about things like integrative oncology stuff, red light therapy, all of that. Where are you finding your information? Is it from an integrative oncologist or a naturopath doctor, or are you finding it through AI?
All through AI, all through those sources that I listed in my resource page. Unfortunately, right? I mean, even when I talked to the doctor for my daughter with red light therapy, they had no idea. When I talked about supplementation and how I saw all this promise on omega-3s, he's like, well, it can't hurt. But they haven't read the research. They don't know about alternative treatments, particularly post surgical treatments. I mean, even too, is silicone gel for scars. And that's why I first started using red light therapy too, is I have keloids and I scar incredibly horrifically. So I was looking for a means to not having so many grotesque scars all over my body. So again, I started using, just back in the day before AI, just search engine results, looking for options, and I found the silicone-based gel that it's not cheap. It's about $60 a tube, but it's miraculous what it does to scar and healing.
Thanks. David Plunkett.
Scott, you mentioned that your doctor and your nephew's doctor withheld information. Can you say a little bit more about that? What was withheld and how did you determine that it had been?
So they didn't give me all the options, right? So my particular case, the doctor's like, you need an orchiectomy, which is removal of the testes, and you need radiation. And that was the only plan. There was no other plan. And then same with my nephew, it was, you need an orchiectomy and you need 10 rounds of chemo. And there was no other plan, right? The surveillance wasn't a plan. So to my nephew, I'm like, wait, you got time. And the doctor literally scared him into getting chemo, saying, if you don't, it's going to spread. If it spreads, you're going to die. And I'm like, no, you listen to me. This is my world. This is what I fucking do, right? Particularly testicular cancer. I'm like, wait, I was like, I funded research on your exact disease on the exact stage. Time is on your hands. Wait 3 months, wait 6 months. And truly, the doctor scared him so much so that he got 9 rounds of chemo. And then I'm even presenting my nephew with the European research, right? Where it's like, hey, the European research says you don't need 3 rounds, you only need 2. And then the doctor's like, that's Europe. And I was like, what's that have to do with anything? People are people. I was like, my nephew is genetically European. So, right, to basically saying you have to go 3 rounds doesn't make any sense. And he's like, well, that's standard of care in America. And I was like, well, this is standard of care in Europe and Asia too. So again, he scared my nephew into having 3 rounds. And then I told my nephew right when he was having chemo, I was like, your tumor markers are normal. So essentially you have no signs of cancer. And he's like, yeah, but there's a small little 2-centimeter node in my chest. I'm like, it could be benign. So you can wait to see if it actually even grows. So long story short, he had 9 rounds, basically 9 weeks of chemo, 3 rounds. After all that, the node was still there. After that, he's like, the doctor's like, now we need to go in and surgically remove the node. And I was like, you don't, it's benign. Let's wait. The doctor scared him into having surgery to remove it, literally cut from here past his belly button. So I actually know the surgeon. I've known him for 10 years, over the years, me funding testicular cancer research. So after he removed the node and the biopsy came back, my nephew reaches out. My nephew's like, oh, I'm so happy I'm cancer free. And I was like, you've been cancer free for a long time. So I reach out to the doctor and I was like, do me a professional courtesy. I was like, what did the biopsy say? I was like, it was fucking benign, wasn't it? And the doctor, no shit, was like, it was benign-like. I was like, there is no such thing as benign-like. He's like, well, it was benign, but it could get bigger. So we removed it. And I was like, yes, it could get bigger or it could stay the same. That's why you go surveillance and you don't remove it immediately. So again, those are decisions, right? Where I'm saying like doctors are adamantly lying, or they're not necessarily giving him options, or talking to the patient in a certain way, where you're scaring them, you're giving them anxiety, you're giving them a false sense of success if they don't go down the path that you want them to go down. And I was showing my nephew, and my nephew's 26, right? And he's still got a kid brain, right? So I'm talking to his mom, my sister-in-law, and I showed her how much money the University of Pennsylvania made off of pharmaceutical companies last year, $750 million. So you can't tell me that does not impact standard of care in America when all around the world, it's less drugs and the efficacy is the same. So that's what I'm trying to educate people. Again, right, here are the facts. There's a website out there that shows every single penny hospitals make and doctors make from pharmaceutical companies. It's there, it's available. Nobody knows about it. So I'm just sharing the information. Here's how much your doctor made. Here's how much the medical facility made. You make the decision. Here's standard of care outside the US. Here's standard of care in the US. You make the decision.
Scott, you represent, as I think I said at the outset, but if I didn't, I should have done, a role model. You're a citizen scientist, you're an advocate, like a super advocate,
Right.
like a rogue advocate, like a crazy
Yep.
maniac advocate. And you're advocating that others should do it as well. And here at the Cancer Patient Lab, we believe that engaged patients get better outcomes.
Absolutely.
And so you must have dealt with this. Let's just stay with, testicular cancer, men. It could be prostate cancer, men. Men are often too macho to talk about their disease. They don't share publicly, as you are, their journey and what they're feeling and their choices. And they're hesitant. They might even be avoiding getting the tests, getting the treatments, having the conversations, doing the research that you're doing. What in your experience can help people? I'm thinking of it as I don't know, some kind of a pyramid, and you're trying to get them to move up the levels of advocacy for themselves. What has been your experience in getting people to be better advocates for themselves?
So, I mean, I was actually a Marine as well. So my cancer is from Camp Lejeune. So I'm sure we're all aware of it, right? Camp Lejeune, toxic drinking water. I was stationed there. I'm one of the statistics. But again, right, me being a Marine, me being a man, right, super macho, right? I mean, everybody could tell you before cancer, I had a stone cold heart, right? I didn't have emotions. So I truly believe, like somebody asked me recently, if I were to change any part of my life, would I? Even cancer. And I said, absolutely not. And I even tell my kids, I am where I am because of where I've been. So cancer truly is my superpower, right? And it's weird is I've reflected so much because I've been sick so much, and every time I go on the table for a surgery, I truly believe I might not wake up, right? So my legacy has been the most important thing for us. And I would ask everybody here, right, whether you have kids or not, I'm looking at it from the standpoint is, what do you want your legacy to be? So I admit I cry, right? My daughter see me cry. I'm highly emotional now. But my biggest thing is I put my ego aside because I want my legacy to be known as the guy who would do anything to help mankind. So that's my thing is, right, we all have a story. We all have a story that can help so many people, to stay alive, right? I mean, again, right, men do not go to doctors. That is fact, right? I mean, most men wait way too long. That's why a lot of men don't get diagnosed to later stages, because there have been problems and we always blame it on something else, or we don't have time. And my thing is, like, I don't care if you have a sore wrists. You just never, same with my daughter. I mean, I've seen it. So my daughter for 9 months was complaining of headaches. 9 fucking months. Her mom, who works in a neuro unit, right, was brushing it off the hormones. Her pediatrician brushing it off the 14-year-old girl hormones. Then she's vomiting. And they're like, oh, she's losing weight. And it's like, oh, not only is she hormonal, she has an eating disorder. And everything was blaming, but at no point in time did anyone ever look at an MRI, look at even an X-ray, right? So everybody missed the basics. And by the time I got involved, I literally took her in for a psych eval because she just wasn't acting herself. I mean, like behaviorally, she changed 180. So I took her in for a psych eval, and while we were there waiting, I asked the attending. So we were in the emergency room waiting for a psych eval, and I asked the attending to do me a favor and let me have a CT scan. She gave a CT scan. It came back with fluid on the brain. And the doctor's like, oh, just fluid on the brain. She's fine. And I'm like, fuck no, I want an MRI. I demanded an MRI. I raised hell to get an MRI. This was like 2 o'clock in the morning on a Saturday night. They did an MRI, came back 5-centimeter tumor in her brain. Again, even there, I had to fight with everybody, right? With pediatricians, with doctors, because as we all know, right? Practitioners no longer have time. They're in, they're out. She doesn't have the same pediatrician all the time. It's always somebody different. No one's looking at the totality of everything that happened to her. All the time she's came in for all these different symptoms that when you look at it, you're like, holy shit, how come no one ran any imaging? And I think, right, we just need to keep on it. We just need the heart, right? We need to see doctors often, occasionally for annual exams. Right, if we have any type of problem, if we're not feeling well, if we're getting sick, if we're having headaches, go in. It takes 30 minutes, oftentimes. Nowadays, and it's amazing with technology, you don't even have to wait in line for urgent care anymore. I can pick up my app and I can make a reservation. So I don't have to go there and sit there for 2-3 hours. At least in Minnesota, I can literally log in, be like, I can check all the urgent cares around in my city, pick the one that has availability, and pick a time so I don't have to wait. So I think that's the biggest thing is, right, we all need to suck up the manliness. Again, I was as manly, if not more manly than most people. Get those annual exams. Talk to people that we know, just like with everything. And here's one important point too. Think about how much time as consumers we spend trying to find a car, trying to figure out what toaster to buy, right? Or what piece of apparel to buy. Imagine if we put that same effort and earnest into finding a doctor. Like, it's mind blowing. I mean, I was the same way. I was guilty, right? At 31, I'm like, urologist near me. Oh shit, there's one right here, 5 blocks away. That's where I'm going. Like, I didn't research. And now I'm like, holy crap. Like, people, and unfortunately, right, we're at the sort of, right, we're undermined by insurance. What insurance do we have? What insurance don't we have? Where do those insurances allow us to go? Does it even allow us to go outside of network or a different tier like the Mayo? But even if your insurance doesn't allow you to, for a long time, I've been calling it the hub or spoke model. So as a data scientist, I actually did research into testicular cancer. I looked at all testicular cancer patients that were diagnosed and treated over a 10-year period. I plotted them on a map. And then because of, I actually created 2 nonprofits in the testicular cancer space, because one biggest thing I had was when I got testicular cancer, like I said, I just went to the guy down the street. What I've realized about diseases is they're specific. When my daughter got diagnosed with brain cancer, I didn't realize there's 140 different types of brain cancer, 140. She had one type. So my thing is, like, I don't care if you've done brain cancer. Have you done her type? Have you done it a lot? And same thing, what I've realized about testicular cancer is only 10,000 guys in the US actually got the disease every year, which means the guy that I went to, and I've learned this after the fact, never treated testicular cancer. I was his first treatment. He didn't know, he never did the surgery before, he never treated it. I was patient number 1. I never asked him, hey, have you done this before? I just assumed. I never asked him, when was the last time you've done this? I just assumed he did it all the time. I was almost hoping that he would tell me, hey, guess what? I've never done this before, and you're my number 1, because I would have been like, shit, I would have left. But because I didn't ask, he didn't tell. So for a lot of us, as we start seeking care, ask the doctor, do you do this? Do you do this often? If not, can you make a referral? But the good thing about, like I said, what I've realized over the years is knowledge is power, right? So with my daughter, like I said, I went on LinkedIn. I found out all the individuals who were posting all their research, who were talking about vestibular schwannomas, who are going to conferences about that specific disease. And I created my network of the best. And I had, and what's amazing too is everybody is willing to talk, particularly if you have a sick child. Everyone sat down with me. So 99% of the doctors talked to me for free. They didn't care about what insurance I had. I had a sick kid. They wanted to help. Harvard was going to be our number 2 facility that we were, adamantly seeking treatment at. So we did that legitimately on the record under the insurance as a second opinion. But it was amazing how many times people would talk to me, sent them my labs, sent my daughter's labs, sat down, talked to me for a half hour, an hour, and walked play by play. And same thing for everybody who's seeking treatment. That's what you want. You want to know play by play. From the time they will you in to the time they put you in ICU, you want the details. I want to know how you're going to basically close the skull. I want to know how you're going to suture her. I want to know how big the wound is going to be. I want to know everything from point A to point B, and we're not going to miss all the plays. I think, right, a lot of times we just go in, we don't care how things are going to happen. But that's where I see things become problematic, is when you're unaware as a patient of truly the steps that are going to take. Same with me. When I woke up from my testicular cancer surgery, I had a C-section. I didn't even think that they would remove my testicle from my belly, right? As a guy, I just assumed it's in my scrotum. They were going to remove it from the scrotum. I woke up and I was cut wide open. I'm like, what the fuck? And they're like, yeah, we had to remove all the tubing. Again, he didn't tell me. I didn't ask. Well, I didn't know to ask. And he didn't provide that information. And I see this time and time again, talking to patients, either pre-surgery or post-surgery. No one's talking about the details, and we all need the details.
I have a couple more questions, but Chris Hopful, you put something in the chat there. Would you raise that with Scott, please?
Oh, sure. And by the way, informed consent is actually, I think, legally required for any physician when he's treating you. So, and the informed consent is actually only valid if it actually explains the proposed treatment, pros and cons, and also explains the alternative, and actually also has an obligation to ensure that the patient really understands it and that the patient actually voluntarily agrees to it. So it can't be done under coercion or under duress or something like that. The reality here in the United States, apparently, and what you experience, sounds unfortunately a little bit different. But from a legal perspective, that's relatively clear. The reality is different, and I think as you are a prime example for that, where you went in with a lot of trust and confidence that the doctors will know, and you had a rude awakening and are now more on the other extreme on, oh, he certainly knows what he is doing. Probably a middle ground is probably good there, but the key is really to speak up for yourself and ask questions and educate yourself. And you actually, I've mentioned this on this channel before. I've mentioned Arkel Giorgio. She has actually a book called Healthcare Choices, and a podcast that's called Speak Up for Your Health. You actually, if you really want superior outcome, you can't just go with standard of care. You actually need to kind of ask questions, educate yourself. And unfortunately, the way how our healthcare system works here is physicians get reimbursed and hospitals by procedure and not by the quality that we are looking for as patients is not something that is properly documented and cannot be logically. And so therefore it's really important to speak up for your health without, I wouldn't go that far and say, how do you close the wound? but in a way, I would like to have a really good understanding of what the procedure entails. And that's actually important.
Let me just jump in quickly on that story.
Actually, can you take this back and this back?
Alan, you're
I'm
on
not doing any work
mute.
here.
Sorry. Ari Ackerstein, a member of this community, tells a story about how he was going to be cut from one end of his chest to the other to do a biopsy or surgery. And he said, can it be done laparoscopically? And the first surgeon said no. The second surgeon said no. The third surgeon said no. A fourth surgeon that he knew said, well, maybe you could talk to this guy over here. You might consider it. He then talked to that surgeon, and the surgeon said no. And he said, well, what about if we did it laparoscopically, and then if there's a problem, you can cut me open? They did it laparoscopically. It saved him from being hospitalized for about 3 weeks. So just to counter your point, Chris, even the way that they're going to cut you open can be on the table for discussion.
Well, and what's crazy too is surgeons aren't necessarily plastic surgeons, right? So, I mean, my cuts are not straight lines. Like sometimes you're like, what were you doing? I mean, they're jagged, they're sharp, right? They're problematic post-cancer care. And same with my nephew. I mean, you look at, I see a lot of surgeries and a lot of pictures, and you look at some of these, is like, there's no way, right? That was done carefully, thinking about long-term, with any finesse. Even my daughter, right? The doctor's like, oh, who cares? It's in her hairline. It's like, well, really?
So to give you a little bit of background, I was made in Germany over half a century ago, and I had proper training as an MD and anesthesiologist. And so we usually take care of our patients, and we keep patients alive despite of surgeons. I'm also an intensivist and also a clinical researcher, and have now a cancer diagnostic lab. When I moved here to the US, there are a few things that I actually learned in this US healthcare system. As an anesthesiologist, you're not on par with the surgeon. The surgeon decides what anesthesia you give. In Germany, it would be illegal to mess into the other procedure. I, as an anesthesiologist, wouldn't say to the surgeon, oh, please do this laparoscopically. Don't do this open. That's not my prerogative. And I feel offended even today. I know it. If a surgeon would tell me how I should do my anesthesia, but it's actually quite interesting. Why can't the surgeon do this? Because the surgeon owns the patient. I've learned. And I said, what do you mean with owns the patient? There are two types of physicians in hospitals. The referring physicians, they bring in the money. Patients come to that person, and as a result, they have the leverage and the power to make decisions. So if you have an aneurysm that could probably, with an interventional radiologist, be coiled, well, if you see the neurosurgeon makes a decision whether he wants to operate on you and open the skull, or whether he let the interventional radiologist to do the procedure. So it's actually interesting, what the hierarchy is. It's also very interesting is how the US healthcare system is optimized for profit maximization. So in many procedures, we have, for cost reason, time is money, we have physician's assistants. Physician's assistant in this country have the right to do everything what the physician believes is acceptable for doing. So for certain procedures, opening, let's say back procedures, opening the skin and removing some of the musculature, or closing the skin, can be done by a physician assistant. It's actually interesting how much in the United States can be delegated to the sufficiently educated or trained person to minimize cost and maximize profits. Effectively, just as a sideline, and one is not aware of that. There are many examples.
When you're in a training facility, it's times 10, right? Where there's residents in there, and there's a whole slew of hierarchy in there who are right observers, learning, touching.
Right. I would say one thing in regards to a training facility. I actually, and since I have trained many residents and vice versa, I usually think that if you are in a training facility, in general, you get better care because the residents are supervised. There is a sense of responsibility to show it how it's done right. And so there is very close supervision in training in the US in that regard. So there I have seen in private practice, when people have been in 20 years in practice and not worked with supervision anymore, that it's more the wild west. So I do think that even if you have a resident or a fellow being involved in the care, I'm more comfortable than an individual private practice guy.
I think
in general.
Let me just jump in with the. Bill, do you had something?
No, I think that's very interesting. And again, it kind of relates to agile programming, and it goes on and relates a little bit to the tumor board stuff and whatever. Generally, if you have two people looking at each other, talking about stuff, recognizing that their opinions are being scanned by the other person, it makes them sharper. Okay, they're going to go on. They have no desire to be embarrassed in front of a peer, or definitely not a superior, in terms of any particular decision that they make. And so they have a tendency to be more careful. And I don't think that really reflects anything about the ethics or anything about the guy. It's what it is to be human. That is, if you go on and have a person that wants to go on and get approval, I think you can use that, in fact, in the creation of these processes. And that's, again, why I like this tumor board stuff a lot too. A lot of times what happens is I do it in two stages. First off, these guys don't get to talk to each other. Then secondly, they do. Now it turns out, do you go on and get a different answer as a result of doing each of these approaches? The other thing I want to go on and kind of bring up, which has not been brought up at all, I'm especially interested in Scott's point of view. I mean, one thing and also I'm very interested in Dr. Affel's point of view. If you go on and look at the United States healthcare in particular, and I've also lived in Germany, so I've got I know a little bit about that too. It's a paternalistic system. I mean, the idea is that, there's this person, they have an obligation, they're going to go on and take care of you and so on. And I know of a father of 3 kids that I can pay more attention to 1 kid than I can pay to 3. And if I wind up pushing to go on and have just end patients I'm going to go on and take care of, I can't take care of end patients nearly as well as I can take care of N over 2 patients, and so on. Ultimately, then what do you do? And I think the answer is, in particular, for a guy that's been a Marine, and I used to work on drilling rigs, you're responsible for yourself. Okay, it turns out ultimately what's going to happen if you get in a bad situation there isn't going to be somebody else taking care of you. There's somebody out there maybe taking care of themselves, and you can watch. That's about as good as it gets. And you have to be taught early on that you're responsible for your own health. No one loves you as much as you do. And you need to go on and pay very careful attention to every decision that's being made on your behalf, not necessarily because these people are evil, not because there's bad intent. They might just be busy. And it might also be that it's a bad day, okay? And there might be any variety of reasons, all of which you get to do, but the concept of a paternalistic system versus a system where you are self-sufficient, you're required to be self-sufficient, you have to take responsibility for your own care, you need to understand all of the options that are available to you, you're the one that's going to suffer the result, so ultimately you're the one that's going to have to go on and make it. That's sort of the direction I'd like to go, but unfortunately we're very far away from that in the United States, and I would argue in Europe too. So I'd be interested in particular, first off, Dr. Apfel, and your opinion on that, and Scott, your opinion as well.
I would agree that it's a paternalistic system. I think the challenge is that it is actually also a system. So we should be also very careful to be too tough. I would like us not to be too tough on our physicians, because the challenge is in this healthcare system. This is actually a quite unique setup, because we have the payers, they're usually the insurance companies, when it comes to who is the customer, right? Then we have the patient who's the beneficiary. We have the physician who has actually decision authority. And then we have also the hospital system and other factors as well. And then we have the legal system in terms of liability on what is considered standard of care. So oncologists often are sometimes feel themselves in shackles. There is the NCCN guidelines. This is the way how you have to practice. If you practice outside of the guidelines, that could be completely legal. If the patient asks for something, you can prescribe a drug that is off-label. It's not illegal to prescribe an off-label drug, but you may actually have a hospital that says, we want you to practice within the NCCN guidelines. And if you prescribe a drug off-label, you'll be fired. And so there are many things that actually keep also physicians, besides their workload, also in line and restrict them in the way that they are often restricted not to be able to treat patients how they would like them to treat it and what they probably originally envisioned.
And so let me repeat your point. One of the reasons you go on and practice standard of care is to reduce your legal liability. And especially if you work inside of a system that has to be taken into account. And as a result, standard of care is what you get, regardless of what the doctor thinks is the best thing to do. Is that what you said?
Yeah, it's I had oncologists who wouldn't refer their patients to me, but if they know one of their relatives is affected, they will send them to stage, right? So
yes, well, that's exactly what happened with me. In fact, when I had to go on and choose a physician, I went on and asked for a referral from my wife's brother, because if I died under the knife, he'd have to deal with her for the rest of his life. And so as a result, well, no, I'm very, very serious about this. So having the appropriate referral at the point that your life is on the line, figuring out those appropriate emotional levers is helpful. So the idea, again, Scott, the idea of pushing patients to be their own shepherds,
advocates,
be their own advocates, and recognize that in fact that it's their problem. It's not the problem of the doctor. It's not the problem of the medical system. And you've danced around this in a lot of your presentation, but effectively, actually, in actualization, that's sort of what you're actually doing, it seems to me. So addressing it from that point of view, head on, what do you think? How do you, first off, do you agree? And then secondly, if it's the case, how do you go on and get people to be Marines, okay, to go on and basically be responsible for their own welfare going forward, and pound in them, recognize that they are responsible for themselves, and that's the primary thing they have to depend on?
Yeah, so for me, again, wholeheartedly agree with you both. Right, the way I visualize it is, right, we are truly consumers of healthcare, right? Just like we're consumers of everything else, right? So it is a product that essentially we're purchasing, and therefore we have to do the same due diligence, right? So take a step back further, right? Right, nowhere in life do we learn about finance, do we learn about healthcare? Right? I never was taught anything about healthcare, how it worked, how it didn't work. Right? We start our first job, right? We're on our parents' plan until we're 26. And then all of a sudden we become adults and then we have a work plan. We don't even know what the work plan is a lot of times, right? It's like you just we just realized for 2025, because my kid's mom works for a healthcare system, it's a lot cheaper for us to get benefits from her, employer than mine. So, I mean, her and I are adults, right? We're both in the system. It took us 2 hours to try to go through all the different options and what they meant. And as educated we are in the healthcare world, it's still incredibly complicated, right? I'm the caregiver to my parents who are on Medicare, Medicaid, right? They're seniors, even more complicated. So I think that's the problem, right? Is oftentimes we don't know what we're buying. We don't know what we're eligible for, what we're not eligible for, and that's age dependent, right? I know I'm going to get older and I'm going to need Medicare, Medicaid. I know a little bit about that based off of having to deal with my parents, and my dad's also a veteran on top of that. So unfortunately, right, as the doctor said, it's a system. It's an incredibly complex system. Um, so I think that's part of it. So one of my younger daughters, right, she's 13. She literally wants to be president of the United States. So I'm always joking around with her saying, when you're president, I want to be a cabinet position and I want to be in charge of education. So I can literally, right, create curriculum to teach people how the healthcare system works, right? On how supplements work, about how nutrition works. So, right, we're part of the system, but that system is not just medical or pharmaceutical, right? It's nutrition. So a lot of our problems deal to the fact that, right, what we eat, processed foods, high amounts of sugar. And I hate to say it, I've seen a lot of studies, alcohol. I believe alcohol is part of the reason why so many people are, why we have an increase of cancer. It's a poison. Right. And then even too, I still believe, once we see CBD and marijuana coming, right, pretty much in every state, just because, right, things are legal doesn't necessarily mean they're good for us. So I think that's a whole nother thing we have to look at is, right, the water we're drinking, right, the microplastics we're consuming. I just saw an open heart surgery where they thought the individual had plaque. It wasn't plaque, it was microplastics. So, right, we're tremendously being exposed by dirty air, polluted water, right, food that's not good for us. So I think it's all of it, right? I think we have to understand our environment shapes us.